Good evening. I have been in Fort Erie now for almost 2 years and thoroughly enjoyed it. One of the first patients I met here was a gentleman called Boyd McRae, and I thought I'd relate his story as written by his wife. And this will explain how important our hospital and 24-hour emergency department is. I feel compelled to relate to you my personal experiences in support of retaining the services of Douglas Memorial Hospital and its 24-hour emergency department in loving memory of my late husband, Cyril Boyd McRae. On several occasions during this past spring, Boyd, who was diagnosed with metastatic renal cancer, which has spread to his lung, would experience shortness of breath, which was caused by a buildup of fluid in his lung. When this condition would occur, I would immediately rush him to the emergency at Douglas Memorial Hospital. Fortunately, our commute to Douglas is less than 10 minutes from our home. I know that this close proximity to this emergency room, providing 24-hour care, afforded us an opportunity for the urgent and vital medical attention to be provided for my husband when time was of the essence. Upon arriving at the hospital, and after his condition was initially evaluated by emergency staff, a procedure was often performed to remove this fluid from his lung. On many of these occasions, often 2 to 3 liters of fluid was extracted from his lung, and as you can imagine, this would immediately alleviate difficulties of breathing and allow him to resume somewhat normal activities and often allow him to return home. In view of my husband's weakened health state, together with the severe pain he was experiencing in his battle to fight cancer, inpatient treatment was often organized. We were most fortunate on these occasions to have him admitted to Douglas Memorial for this purpose. This helped us realize the importance of our local hospital. As an inpatient at Douglas, my husband not only benefited from the services provided, but most importantly, it enabled our family physician immediate access to him for his personal examination, observation, and assessment of his condition. Our family was ultimately granted precious extra time to be able to spend with my husband before his untimely passing, thanks in large to the measure of 24-hour emergency services and the ability of my husband on these many occasions to promptly receive essential care. I seriously doubt whether my husband would have survived a much longer commute of approximately 30 minutes to the closest, nearest hospital. Therefore, I respectfully request that you take in consideration of my own personal experiences in my late husband's memory when you make your final decision on the future of our local community hospital, keeping in mind not only the travel encountered driving to the nearest emergency room in the next town when every minute counts, but also the additional travel of time incurred in the inclement weather conditions which often occur in our time of Fort Erie. In Fort Erie, we have an elderly population. We have a high disease burden. I'm always struck by the amount of cancer that's present in our community. It makes absolutely no sense whatsoever to close our hospital and 24-hour ER. The people of Fort Erie need to be aware they have absolutely everything to lose and nothing to gain from this current plan. Thank you, Dr. Kitts.